Hello, and welcome back to our celebration of World Food Safety Day, Safe Food Now for a Healthy Tomorrow. This year, we at the National Environmental Health Association teamed up with Environmental Health Australia to host a food safety marathon that started in the morning of Australia's June 7th and continued for almost 24 hours as World Food Safety Day began in the Western Hemisphere. We've chatted with food safety professionals from all around the globe, from Australia to Papua New Guinea, from Egypt to the United States. And I'm pleased now to introduce you to our final speaker, Linnees Greenbaker from Jamaica. Ms. Greenbaker is the Chief Public Health Inspector and Head of Department for the Environmental Health Unit in the parish of Clarendon within the Southern Regional Health Authority, Ministry of Health and Wellness in Jamaica. A Northern Caribbean University graduate with an MPH in Health Promotion and Education, she is a service-oriented public health practitioner with 22 years of distinguished service in meats and other food inspections, public health regulatory compliance, supervisory management, and workplace wellness. Her proactive contributions foster a safety culture using risk management principles to improve planning and decision-making. Linnees leads a team of 35 public health inspectors that administer 10 environmental/public health and sanitation programs, and she contributes to improved productivity and organizational image through staff development, training, mentorship, networking, and pooling of resources. In 2017, Linnees was awarded the Most Outstanding Technical Officer, as well as Outstanding Performance in Leadership and Professionalism by her organization. She also teaches supervisory management and fundamentals of occupational health and safety at the University of West Indies, Mona Open Campus. Linnees, it's wonderful to have you today. Thank you so much for joining us.
I'm happy to be here with you, Laura. Thank you too.
All right, well, let's dive in. Tell me, what does an average day look like for a food safety inspector in Jamaica?
In Jamaica, public health inspectors with this specialized training in food safety would normally report to office and prepare with their tools of trade to match whatever task or purpose of duty that they will be performing that given day. So a visit, for example, can either be for routine monitoring, or it could be for the purpose of survey for compliance, or to address a complaint, or visits may be announced or unannounced. So for the visit itself, it is divided into three components. You have the entrance interview. At that point, what we do, we will engage with the operator, identify ourselves, do the introductory part of it, and would gather the information we would need to proceed into the second part of the visit, which would be the actual inspection. So for us, what we do, we would ask that a member of the establishment accompanies the officer while they're doing the inspection. And the purpose for that is to ensure that whatever we are seeing, they're seeing too, and also from the perspective from which we are seeing it. At the end of that inspection, then we will just tie everything up with the exit interview where the findings will be discussed. And just to say, for the inspection, we use a prescribed Ministry of Health tool that is standardized, and it is divided into critical areas or non-critical. So it's basically employing the HACCP, the Hazard Analysis of Critical Control Point principles. So in a typical day, that is what it entails. So it is dependent on the type of establishment, and as I would have established earlier, the purpose of the visit.
Wonderful. And you mentioned that having the inspector be accompanied by the person in charge at the establishment. Mm-hmm. How do you support retail food establishments in improving their food safety practices?
Well, as a regulator, we not just see ourselves as regulator, but we see ourselves as facilitators of the industry, because food is basic need of man. So in terms of supporting our local industry, primarily, of course, as was established, our role is that of regulator. So we do the audit visits. In Jamaica, what we practice is After doing the assessment, we would issue with a work plan if breaches are found. So that work plan would provide technical advice for the person. We also engage in training and certification of food handlers. So we keep them up to date with benchmark and best practices from across the globe. We also make ourselves available in terms of advising them. Sometimes there are particular systems in place that we have to make adaptable to our local culture. So in those regards, we help to support them by being accessible, being there to facilitate the inspections in a speedy manner, as well as to bring them up to speed through conferences, seminars, workshops. We do a lot of community mobilization and engagement. So those are some of the ways we support our retail food entities.
Sounds like, thank you. It sounds like the partnership with the industry is really important, and working together and not only providing training, but providing resources for them and adapting it to the area. And I think that's such an important part of understanding your communities to better be able to support them. So that's really great to hear. So I see that you work with a lot of your industry members. Can you tell us a little bit about what other organizations Jamaica might work with to enhance food safety on the island?
Yes. So we see food safety we approach food safety rather as a public-private partnership. So depending on what is at stake. At the national level, we have our standards organization, the Bureau of Standards Jamaica, which help to provide the regulatory standards at which these food must be produced, as well as we have the National Food Industry Task Force. And the purpose of that task force is to help in terms of labeling. We understand the implication with food safety and food, how we consume, and NCDs which we are experiencing now. So in terms of marketing and education and communication, advocacy as well, the National Food Industry Task Force, we work with them to ensure that persons are in keeping with what is expected, not just locally, but internationally, because we just don't want to be able to feed our local population. We want to export too. We want to just enhance what we have through value-added products. So these agencies like Bureau of Standard, the National Task Force on the national level, we also have the National Public Health Lab. And in Jamaica, food safety currently falls under the remit of the Ministry of Health and Wellness, whereas sometimes in other jurisdictions, it would fall under the Ministry of Agriculture. So agriculture is also one of Ministry of Agriculture, Fisheries, Commerce, is also one of our key stakeholders at the national level. Now, segueing into the local setting, we have our municipal corporations, whose responsibility will be to help to regulate compliance, for example, in certain retail establishments such as markets, meat shops, even itinerant vendors, or in some jurisdictions, these would be called street food vendors. So we work with them as it relates to the licensing of those persons who would desire a license or a permit to operate. Then we also work with our non-government and our community-based organizations. So we will go in the community in health fairs and we'll make persons be aware of what is expected from them as an operator, as also to give them tips as to how to best handle food. So these are some of the ways in which we engage with other agencies to effect our duties as public health food safety officers.
I see. It seems that everyone is involved in that, from your inspectors all the way to your public health labs and you're in the industry. And, you know, I've said this on the previous chats that we've had, food safety is everyone's business.
Everybody's business.
Yeah, it's really true. It's really true. So, Linnees, you mentioned a couple of types of establishments that you regulate in Jamaica. Are there some that are unique to your community that you'd like to share with us?
Yes. So I'll just use the opportunity to just list a few, and then I'll tell you the one that, in my estimation, I deem unique to Jamaica. So we, as a part of our retail food industries sectors that we monitor would be restaurants, or fast food outlets, bakeries, food shops, or grocery shops. In some jurisdictions, they might be called cottage industry, and especially in this time of COVID, where we have persons starting businesses outside of their home setting, cottage industry, supermarkets, delis, meat shops, and markets, as would have mentioned. But there's a special niche of itinerant mobile or street vendors that I think is unique to Jamaica, and that's the jerk pan man. So they offer jerk, normally protein type food like chicken, pork, and in some cases, when we have like competitions going on, or in the restaurant, Jamaica Restaurant Week, when you have persons encouraged to go out and eat, you might have fish, and we just try to jerk everything. So I think that is uniquely Jamaican. It's like a morph from the barbecue grill, which you'd used to. So this is done in a pan, a pan setting. It's like a 45-gallon drum, which persons are used to metal, and then you have them jerking it. It is done along the street. It is challenging in some regard to manage, in that they mostly use potentially hazardous food. So we have to ensure that the temperature, the cold chain for the food is maintained. We have to ensure that they have access to the basic amenities. So in terms of their positioning, where they're allowed to be placed, is also important. But we see a lot of creativity coming out in this industry. So as it relates to what's unique to Jamaica, the first one I could think of would be the jerk pan man, who sells on the street as a mobile street vendor.
I see. And it sounds like they serve a lot of food, especially at the festivals that you have, the celebrations. That sounds like a lot of fun, but also I'm happy to know that there's so many people in Jamaica that are looking over the food safety of the products, but it sounds like a very interesting time.
Yes.
Lynette, we got an audience question I'd like to ask you, kind of switching over from the training for the industry and partnerships and collaboration to learning a little bit about what kind of credentialing or training that public health inspectors in Jamaica receive. So can you tell us a little bit about what an inspector might anticipate for training and education, or any kind of credentialing that you all do there?
In Jamaica, thank you, Laura, for that question. In Jamaica, we, as public health inspectors, it's a degree training program, which is done through the University of Technology Jamaica exclusively. You are exposed to a gamut of public health, not just food safety, because there are different levels or specialization in public health. So at the basic entry requirement, you will need 5 O-levels, or it's a very competitive field now. So we have persons going in with their advanced high school exit exams, or even associate degrees in environmental health, just to be a part of the program. So they will study for 4 years, and a part of that 4 year, you have an internship program where you have the hands-on transition from theory to practice. We receive training, for example, in environmental matters, but even though we are called public health inspectors, we have responsibility for general sanitation, which will take in environmental issues. So we're exposed to forestry, we are exposed to sustainable development, we're exposed to water quality training, vector control, and integrated pest management training, as well as food safety, foodborne illness investigation, and other epidemiological duties. And of course, as more relevant now for port health and quarantine, we are also very involved in that. So we have several specialized program areas, as was mentioned, at least 10 program areas we will participate in. We look at water quality, both potable water, drinking water, as well as wastewater management. Institutional health and safety, where we monitor both our residential and educational institution. So the public health inspector, as we describe, we deem ourselves as one of the most comprehensively trained professionals in Jamaica. So we impact lives from the womb to the tomb. So every gamut of life, the public health inspector impacts, depending on your specialized area of training and your level at which you operate within the public health framework. I hope I was able to answer the question.
You did, absolutely. And I really liked that saying from womb to
From the womb
tomb.
to the tomb, yes.
Yes.
So
So
from birth, we're actively involved, for example, in immunization and vaccination, even as we are now in this pandemic, to the point of burials. We have to ensure that burials take place within the confines of the law, especially also as it relates to this time of the pandemic. So from the womb to the tomb.
wow, very, very important. I often find that when I explain the role of an environmental health specialist or a public health inspector, when we explain that to the general public, I don't think they often understand that it encompasses so much. I mean, water safety and drinking water and, hazardous waste management and, like you were saying, forestry and food safety. Really, we do so much as environmental health professionals, and it's just really, it's really daunting to think about everything that everyone does, but realizing that it's so important to public health is very impressive, I think, in my eyes anyway.
It's a complete ministry within itself.
That is very true. That's very true. Well, I'd like to know a little bit about what happens when there's a foodborne illness outbreak, because different countries have different ways and different agencies and organizations they coordinate to investigate. Can you tell me what would happen if there was a foodborne illness outbreak? How would your agency respond?
In Jamaica, as public health inspectors, we operate under the ambit of the Public Health Act, which has accompanying regulations such as the food handling regulation, as we're on the topic, the nuisance regulation, we have the barbers, hairdressers, we have the tourist establishment, and we have, for example, the meat regulation and the butcher's regulation. So food at any point can contribute to outbreaks if they are not handled properly. So in Jamaica, foodborne illness outbreaks are classified as reportable incidences. So we would have had a reportable disease, class 1, class 2, based on the seriousness. So food safety is so important that when an outbreak occurs, it is mandated that it is reported to the national level. And at the local level now, it is done utilizing a team approach. So we'd have members of the epidemiological surveillance unit, which would include other health professionals such as the public health nurses and other field officers. We'd also engage our national public health laboratory because if we need to take sample. But what we embrace, even though we have our local legislation, and in the event where something is not covered under our regulation, the Codex Alimentarius standards apply. So we utilize the general universal 7-step investigation for complaint, where we determine, first of all, if an outbreak had occurred, and we would also define the case in terms of the make contact to coordinate with key personnel. Then we are going to obtain clinical specimen and food samples for lab analysis, as I said. So at first, we need to notify the lab that we have suspicion that an outbreak has occurred. So we'll be sending in samples to make sure they have the necessary reagents and so on. We also implement step 4, implement control measures to prevent and to define the case and conduct case findings. We describe the outbreak in terms of the time and the place and the person, because these would make for excellent case studies. And we want to look at what went wrong so we can put control measures in place so that we won't have recurrence. Then we want to develop possible hypotheses, and we want to plan and conduct epidemiological studies around the hypotheses to test it to see if it's really as we purport it to be. Then we have analysis of our data, interpreting the result, and then the final step would be that of reporting, declaring the outbreak over after we would have done all of those investigation and compiling our reports. So we in Jamaica do subscribe to the 7-step international standard of investigating a disease outbreak in terms of foodborne illness.
Wow. You know, what I really liked about your response was not only are you reacting to the issue and you're working with all of these organizations, at the same time you're gathering information to put together case studies, to analyze what you're looking at, to help prevent. And I think that's just such an important part of public health, is looking at what has happened, where is the breakdown happening, and what can we do in the future to improve it or to mitigate that risk. And I just think that's a wonderful thing that Jamaica is doing, and I'm sure other jurisdictions and countries around the country do that as well. But really, we can learn a lot from these outbreaks, and some really great regulations and great ideas in food safety and vast improvements of systems have come from unfortunate outbreaks. So that's a really great thing to hear, Linnees. Thank you so much.
And if I may add, Laura, but it does also save us time, because when we have it documented already, we have that as a reference point. And then it will help to build capacity of your team. So in the period when everything is fine, you can have that as a case study, as a desktop study, where you can say, all right, this is a particular situation. How would you handle it if it was in your jurisdiction, or if should we be faced with this? So it helps us to save time by practicing ahead, using these as case studies.
Certainly. Wow, really great. Well, I'd like to get kind of into a little bit more of a personal question here. And okay. I'd like to know, what inspires you to work in food safety? And I know you do many things in environmental health, but what inspires you specifically in food safety to do what you do?
I believe, Laura, that I was born for this job. I get my job satisfaction from helping others to empower themselves. So when you do a visit, for me, it's not just a visit as a regulator. I am convinced that my role encompasses more than just the basic regulatory compliance functions. So my personal mission statement, or my mission rather, is to use my skill set, which I would have gathered, the competencies I would have learned and developed in food safety, as well as being trained in health promotion, to help food handlers to see the actual as well as the perceived risks and the susceptibilities associated with their trade. Because when they can do that, you would not have to be there to be pointing out to them all the time. They can deduce that from their own experience to say, I'm susceptible to this. If I continue along this way, my business will succumb. So when we do that, in terms of helping them to see, empowering them through knowledge, and also hands-on experience or guidance, it will, if they use that knowledge to make the choice, they will make meaningful changes, not only to their personal businesses, but the local landscape. So for me, seeing lives and businesses being transformed through my deliberate intervention, that inspires me. That is what is my drive and motivation for food safety. Seeing a business transform from being unsatisfactory, how we would deem them if they have demerit, to being satisfactory, and not just crossing that threshold, but maintaining it and expanding to develop. That is what inspires me.
That's really wonderful to hear, and certainly inspiring to listen to. I think that environmental health professionals and food safety professionals, there's always this reason, this inspirational reason. And one of the things that I always say is, everybody eats, and protecting the food supply, you're protecting your friends, your family members, your colleagues, your acquaintances, your businesses, your country. And it's just really inspirational to hear you to say that, that you were born for this, because I think that a lot of us can relate for certain. We do have an audience comment that I wanted to read aloud. It says, "Thanks for the excellent presentation, Linnees. Great to see Jamaica is making an effort to ensure safe food in spite of the challenges." And I definitely second that. I think this has been a really wonderful time chatting with you and getting to know a little bit more about Jamaica and how you handle food safety. Do you have any parting words for our audience, or anything you would like to share before we close out this session?
Thank you for that opportunity, Laura. I would want persons, not just in Jamaica, but everyone, to understand and appreciate that the industry is not without its fair challenge. So as you established earlier, Laura, that food safety is everybody's business. We all have a role to play as producers, regulators, and consumers, because we are what we eat, you said in one setting, and then we are also what we eat. So we have to safeguard in terms of public health. It's about promoting health and efficiency, prolonging life, and preventing diseases. So we cater for whole health. And we want persons not just to eat and enjoy food, but to ensure that the food that they're eating is of sustenance and nourishment to their bodies, so that we can enjoy wholesome, not just quantity of life, but quality of life. Thank you, Laura.
Lovely. Well said, Linnees. Thank you so much. And I thank you so much for sharing your information with us today. Thank you to all of the audience members for their participation. And of course, a sincere thank you to Environmental Health Australia for partnering with us today as we highlight just the important work that's being done around the world to protect the food supply. Many thanks to our speakers and those who helped coordinate. Thank you to our guests and all of the food safety professionals for what you do to protect public health. So thank you so much for celebrating World Food Safety Day with us, and we look forward to continuing the conversation of food safety. Thank you.
Thank you, Laura.